year one kid really struggling with reading and writing. They've got their GP referrals to the pediatrician, but it's a long wait, and they don't really know what to do. They've also been to a tutoring center which has flagged potential dyslexia, which is not, unfortunately, really any more helpful than what you already knew. Um, so this parent is in the same position that a lot of parents are in. They don't really know exactly how to go about getting a diagnosis, who can do it, what should be done, how long should it take, how much should it cost, and that sort of thing. But the first thing to know is, should you go to your GP if you have this question? Absolutely. The GP is a great person to guide you on where to go next, and also to give you referrals for Medicare and that sort of thing, so you can get some sort of rebate, which you can get a rebate on dyslexia assessment, especially if you are seeing like a speech pathology clinic like ours, because there's Medicare plans that include speech pathology services. But you do not have to go to a GP to get that done. The next thing is, should you go to the pediatrician to get your dyslexia diagnosis? Um, I'm going to say basically no, to be honest. Pediatricians can diagnose dyslexia, but I've never in my life seen one that's actually done a reading test. They either just get the reading test results from another clinician, or they just diagnose it just point blank. They're like, hey, I've seen your kid for 10 minutes, once or twice. I'm diagnosing with dyslexia. That is a hazardous way to do it, because there's lots of things that can look like dyslexia. I've got other videos on this, but basically don't want someone to just talk to you and your kid for 20 minutes and then diagnose them. You need to do actual comprehensive testing. So you can go to the ped. Technically, they can give you the diagnosis, but I wouldn't wait 9 months for it, because you're just going to find out they want you to go and get a test done by a speechy or a psych or something like that. Um, the whole thing with the tutor sensor giving possible dyslexia, this brings me to another point. Families should really be aware that there are dyslexia screeners, and then there are actual diagnostic dyslexia tests. A screener just tells you if you are at risk of having that thing, but it cannot be used for diagnostic purposes. You can't get an actual proper diagnosis from it. That's the whole point of it being a screener. Screeners are good because they're really fast and they sort of let you know what you should look into further, but they're not that helpful if you want the actual answer. So if you've got a screener result or something else that's making you think the kid might have a learning disorder, you need to basically go to an allied health practice, like a speech pathology practice or a psychologist, and they can do the actual diagnostic testing and give you the proper diagnosis from that. In terms of what to do next, if this person's already seeing a tutor for an hour a week to help with the basics, and they want to know what other steps you can take, I would say you're definitely already on the right track. I mean, getting some sort of structured intervention as soon as you can, as much as you can, that's fantastic. Start it as early as possible. An hour a week is fine, as long as you are doing heaps of homework. Like, you should be doing 10, 15, 20 minutes of homework basically every day, ideally at least 3 or 4 times a week if you want to make good progress. And the tutor or the program should include structured stuff for you to do at home. They should be teaching you how to do it so you know what to do so that it's productive. If you are finding that the tutoring isn't really working that well, you might need to go to something a little bit more robust or a little bit more evidence-based. And that's again where allied health clinics can come in, because you know you're getting an actual evidence-based systematic phonics program or something like that, rather than potentially quite variable results from tutors. I mean, some tutors are doing gold standard evidence-based programs, fantastic. Others that we've seen families bring work in from are doing kind of just like random assortments of worksheets, which probably would work for a kid who's just a little bit behind, but not for someone who has an actual learning disorder. You need really targeted intensive intervention for kids with dyslexia and dysgraphia. So just make sure that the quality of the tutoring is good. If you don't know how to judge that, the easiest thing A is to either just see the progress. If the kid's making progress, that's great. If they're not, that's a red flag. And B, a more specific question you can ask is this a systematic phonics program? If they do not know how to answer that question, I would take that as a no, it's not. And if it is, then that's great. And if they say no, that it's not, then I would also take that as a red flag. Um, Systematic phonics is the gold standard evidence-based way to teach kids to read and write, including with where they have dyslexia or dysgraphia. So it's got to be that. Otherwise, there's a very good chance that you are wasting your time. There are lots and lots and lots, like literally hundreds of systematic phonics programs out there. There's not one that you have to do. So don't get bogged down in that. The evidence is just around that type of program. That's the thing that you need. So just ask about that.